Okay, good. All right, well, this is a very special lecture for me because I knew Lord Soulsby quite well. Actually, in 1996 and 1997, when I was at the World Health Organization, seconded from the CDC in Atlanta, we decided to raise the issue of antimicrobial resistance. And Lord Soulsby actually attended our first meeting when we were trying to develop a strategy of how to move this ahead forward, and became a strong advocate at that time for our activities. In fact, he was ready to take this into the Parliamentary Scientific Committee because he felt it was such an important issue between the human and the animal sectors. So we developed the strategy, we moved it ahead, and then the release was on the 11th of September in 2001, to be followed 2 days later by a release here in London. The release was in Washington, to be released 2 days later here in London, and then to go into a Parliamentary Scientific Committee. As you know, that was aborted because of events on the 11th of September. And the strategy took a back seat for quite a while and has now been rejuvenated thanks to the efforts of Sally Davis here in the UK, who has really moved the agenda forward within WHO and globally. So what I'm going to talk about today is One World, One Health, and Swiss cheese, animals, the climate, and human behavior. Now, what I'm telling you is nothing new. You all know these issues. What I'll try to do is present them in a way that you can use if you wish to, if it's useful in the future. And an emergence involves three general pathways. This is when an organism breaches the species barrier between animals and humans and causes human infection. The first is no further transmission. A good example, rabies. It breaches the barrier, it infects a human, it doesn't go further unless there's an organ transplant. The second, it continues transmission in a cluster or in an epidemic or a pandemic, but then it disappears. And a good example of this is the Ebola virus, or H5N1, which causes outbreaks and clusters from time to time, but doesn't go on to remain, it goes back into nature and reoccurs at another time. And then the third, of course, is one that continues transmission and becomes endemic, and that's a good example of HIV, which is thought to have emerged from the non-human primate population early in the 20th century and is now an endemic disease throughout the world. These diseases are all at the human-animal interface. They're zoonotic infections of humans, and they spread internationally at times, and they also cause severe economic damage. You can see here, in the Ebola outbreak, over 11,000 deaths, and you can see that the deficit to the GDP was minus 23.9%, minus 24%. So a huge toll on human illness, human deaths, but also on the economy. And recent infectious disease outbreaks have all caused severe economic problems as well as threats to human health and security. But in addition, as was seen with Ebola, when they occur, they also spread internationally. And this is the Eco Challenge, a triathlon in Malaysia in the Cameron Highlands in the year 2000. Jungle running, swimming down rivers, and mountain biking in an area where there was leptospirosis. And those of you who are not medical, leptospirosis comes from either rodents or animals or wild animals or livestock. It infects water probably through the urine most times, and then if humans are in contact with that water, they become infected. There were actually 312 athletes who participated in this triathlon, and of those, 33 returned home in healthy state but soon developed fever and were hospitalized with severe illness, and many of them died because the diagnosis was missed. This was leptospirosis from the Eco Challenge, probably swimming in the waters during that challenge. SARS, you'll remember, which occurred in the 21st century. What this diagram shows you is a hotel in Hong Kong, And the red dot is an area where environmental samples were collected and were positive for the SARS coronavirus. They were in the carpet outside the lift area in the hotel. You can also see where the person who came in from China, a doctor, a medical doctor who'd been treating patients, came into room K, green, and from that room there were others infected in that same hallway, and then they spread the infection around the world. So from an animal source in China to a doctor treating patients with a new emerging infection that he didn't recognize, to a hotel in Hong Kong, and then around the world. The classic example of emerging infections. This did cause over 8,000 cases, 774 deaths in 37 countries, but it was fully contained by travel measures and a whole series of activities under a very strong Director General at the World Health Organization, Gro Harlem Brundtland, a pediatrician, a former prime minister, and an excellent politician. And she was able to impose travel recommendations to countries and have them accept them, and the outbreak was contained. But the effect on the GDPs in these countries was phenomenal. Short-lived, but phenomenal. Most recently, we've had another zoonotic infection, Zika virus, somehow infecting humans and then being transmitted human to human by mosquito vectors, causing outbreaks throughout the Americas and throughout the Pacific, and being associated with microcephaly. The clear evidence from the Brazilian Ministry of Health showing that from 2010-2014 there was a baseline of microcephaly, rapidly jumping in 2015. These events are really what James Reason would call Swiss cheese events. Now, James Reason wrote an article about accidents and how accidents occur. And he talked about the Swiss cheese model. And each of the holes on that Swiss cheese represents some type of a risk factor. And if those risk factors line up in such a way that this cheese, that an arrow can be put through them, there's an event that occurs. In public health, the risk factors line up in such a way that a public health event occurs. And what I'm going to do is just show you some public health events that have been Swiss cheese events over the past few years. And I'd start with the former Sudan. It's now, as you know, North and South Sudan. At that time it was Sudan. And in Sudan, the major export is ruminant animals. Ruminant animals across the Red Sea into Saudi Arabia, Yemen, and the Arabian Peninsula. This is especially important at times of religious sacrifice when the animals are shipped across the Red Sea. Now, in the Rift Valley, in East Africa, there's, as you know, the virus that causes Rift Valley fever. This is harbored in wildlife and also in domestic ruminant animals, and the transmission is from animals or to humans, either by mosquito, an Aedes, or a Culex, or by blood during butchering, or in this case, a ritual sacrifice. So as you can see, there was a disease in the area called Rift Valley fever, a zoonotic disease, a known disease. And there was a vaccine, a veterinary vaccine that was used to prevent this infection in ruminant animals. But in the 1990s, that vaccine, which was produced in Kenya, ran out. And there was not enough vaccine to continue vaccinating animals. So that's the first hole in the Swiss cheese, if you will. The fact that ruminant animals were not vaccinated against Rift Valley fever. The second is another event showing how important One Health, One World is, because there were El Nino events that occurred in East Africa and off the coast of East Africa at that time, which caused massive flooding. And as you know, flooding pushes animals and humans closer together on dry land, and that's the second hole in the Swiss cheese. Close proximity of animals and humans. The third factor is clearly associated with water. It was an increase in breeding sites for the Culex or the Aedes in those stagnant areas where water was standing. Together, they ended up in a Rift Valley fever outbreak with over 300 cases in Sudan. Here you can see one of the patients. It had a severely high mortality. As you know, most zoonotic infections that are newly acquired by humans are very damaging to humans. And in this instance, it's no different. It was a severe disease which caused many deaths. Now, there's some more holes on this Swiss cheese because this is the Port Sudan, where goods cross from Sudan into Saudi Arabia and Yemen. And you can see two types of boats on this picture. One are small boats, one are large boats. The large boats are usually commercial. They usually require vaccination of animals if they're being transported across the Red Sea. But the smaller boats oftentimes carry clandestine trade across the sea. Somehow, during the trade patterns between Port Sudan and Saudi Arabia, there was a possibility for the virus to enter Saudi Arabia and Yemen. And 2 years later, a major outbreak of Rift Valley fever in animals and humans in Saudi Arabia and Yemen. And the infection is now endemic in the Arabian Peninsula. Now, what are the solutions to this? Well, clearly, they have to be technical. There are guidelines that we all have access to for mitigation and also for prevention of mosquito-borne diseases, whatever they are, of vector-borne diseases. But there also has to be, and I know this is what Andy will be talking about, there also need to be some political actions. And we as a health community, both veterinary and human health, need to make sure that the United Nations understands the issues involved of health and climate change. And we need to continue to make those arguments, as Andy always does, and make sure that they pick this up and understand this, because this is one of the reasons. So, having talked about a very important Swiss cheese event, I'll talk about another. And that I talked about earlier, the Ebola outbreak. The Ebola outbreak was also a Swiss cheese event, an event at the interface of animals and humans that then became a major public health event. As you know, the hypothesis, not proven yet, is that bats, fruit bats, carry the Ebola virus in nature. They infect either an animal or a human directly. That animal then can infect humans either through the butchering process or in some other way, and it causes Ebola. This is the first outbreak of Ebola in 1976. This is the mission hospital at the Yambuku mission in DRC, then known as Zaire. What you can see at the lower side of the road at the left is the hospital. On the right is the school. Both very important in this outbreak. This is Wild Animal Market near Yambuku. This is where animals are bought, they're butchered at home, and they're fed to families. And this is the family of the schoolmaster, the headmaster of the school at the Yambuku mission. Now the headmaster bought a wild animal in the market, took it home, and butchered it, and fed it to his family. A few days later, his name is Makilo Obata, it's in green. A few days later, he arrived at the outpatient clinic at the hospital at the Yambuku mission. He was from Yandongi, which is the town just next door, about 5 kilometers away, and he made his way to the mission. This is the implements that were in the outpatient department at that hospital. And there are 4 syringes, 2 needles, and some obstetrical equipment. Because this equipment was shared between the outpatient clinic and the obstetrics unit. So when there was a delivery, the equipment went from the outpatient department into the maternity. It's not difficult to see what happened. Those needles and syringes were not sterilized. They were used to treat the headmaster, who actually had what they thought was malaria. He had an injection of quinolone, and he was taken home. He died shortly afterwards. But the needles and syringes were contaminated and were not sterilized. This is the outbreak. What you can see here in the In the bottom is needle and syringe, the pink, contact with either needle and contact or needle and syringe, and then health workers in the contacts. And this is a classic Ebola outbreak. Ebola outbreaks don't need to occur, and I'll prove that to you as we go on. What happens is that hospitals with poor infection control amplify transmission, and then the health workers carry it into the community to their own families. This is the second outbreak of Ebola 1 year later, which you don't know about. This is written up in the Journal of Internal Medicine, if you want to read it, Journal of Infectious Diseases. And this hospital was about 250 kilometers to the west of Yambuku. This was also a mission hospital, and the doctor in charge of this hospital had been to Yambuku, helping with the outbreak in Yambuku. When a patient presented to his hospital with fever and signs that he thought might be Ebola, he isolated that patient, and there was only one case in this emergence. This case was the person admitted to the hospital. She was isolated, she didn't spread it further, but there was one contact in the household, his sister, who fit the possible case definition and who survived and did have antibodies. So Tom Cairns, who was at the head, this doctor at the head of the mission, set up an Ebola hemorrhagic fever surveillance activity with support from the World Health Organization. And what he did was, you can see Tandala on the map. I have to find it here. Yeah, okay, you can see Tandala, and you can see the black dots, which are the communities in which the surveillance system was conducted. And Tom trained people in each of those communities to recognize when someone might have had Ebola through a possible, probable, or confirmed case definition. He then taught them how to do an investigation, and also that he should come immediately when they saw a case such as this. He took those patients, he isolated them in the hospital, and what you can see here is, in the last column, of the 98 who were thought to be either possible clinical or probable cases, 21 were actually Ebola. Ebola emerges periodically. It doesn't spread unless it gets into hospitals. Here's the third outbreak of Ebola, also in DRC in 1995, and here's the graph of that outbreak. The patient was admitted to the hospital in March. He was actually at the end of a chain of slow transmission which began in January, probably a charcoal worker in the forest who was making charcoal, came into his village sick, a slow chain of transmission. In March, he was admitted to the hospital in Yambuku. Two health workers, a nurse and a laboratory person, treating that patient became ill. You can see what happened. The outbreak spread throughout health workers and then into the community. There have been many outbreaks of Ebola, as you know, in Africa. We won't go through these, but I'll just move up to the most recent outbreak, again, an outbreak where health workers suffered, and health workers also, unbeknowingly, were continuing to spread the outbreak into communities. So Ebola is a disease that we can prevent. We don't need vaccines, we need good infection control in hospitals. And if we can convince mission hospitals and others to do good infection control, when a vaccine comes along, it will be helpful, but we don't need it to stop outbreaks. All these outbreaks have been stopped by community involvement and understanding of what was going on. So let's move on to the area that Lord Soulsby was very interested in, and that's antimicrobial resistance. And this is just to show you at the top humans, at the bottom food-producing animals, and how we share many different organisms and also many different resistant organisms. There's a constant interaction. Human health is always trying to blame animal health. Animal health is trying to blame human health. And in the end, nobody can really prove which way those organisms are going, but they're there, and we have to deal with them. Now, for those of you who aren't scientists, it's very easy to understand what happens in antimicrobial resistance. The original bacteria have differing degrees of resistance already because of mutations, because of their characteristics. And if you treat those organisms and you only you treat all those that are not highly resistant, you get rid of them, and you end up with highly resistant organisms in the middle. Those highly resistant organisms can then spread further. This occurs from low doses of antibiotic, which kill only those yellow, orange, and brownish organisms and leave the resistant organisms, both in animals and humans. Or it can occur if there are too many antibiotics used, because they then can get into the gut flora and do the same thing with those flora in the gut. So it's a very important process. It's one that Lord Soulsby understood very well. Now, the environment, one health, one world, is also very important in resistance, because as you know, there can be plasmid exchange, and there can be organisms in the environment or in other environments, other than the direct environment of humans, which can do a plasmid exchange and transfer that genetic material to other organisms. Now, the food chain is very complex, and this is just to show you some of the issues involved in antimicrobial resistance. Human medicine uses antibiotics. Animal medicine, both domestic and farm animals, use antibiotics. The fruit farms use antibiotics and other vegetables. Orchid growth depends on antibiotics, as do food without certain blights. And they all combine together in the environment, and they can interact either from sludge ponds of agriculture or from defiant systems of sanitation. There are many, many opportunities. There are many opportunities for this, and these as well are Swiss cheese events. I'll just show you a Swiss cheese event in Puget Sound in salmon farming, because salmon farming is incredibly important in Norway, in Puget Sound, and in other places around the world. Most of the salmon that we eat, I would think you said right, are raised in farms, aquaculture. And so in aquaculture, there is a need to keep those fish free of any infections which slow their growth. And these are intestinal parasites and many other parasites, intestinal organisms, which are found. Now this is the farming, and this is what was found in the sludge drawn up from the bottom of Puget Sound, looking at Pseudomonas, E. coli, Enterobacter, and Enterococci. They all have resistance to a certain extent, found in Puget Sound and coming into the environment. Now, there's been vaccines developed, as you know, against these organisms. In fact, all the gut organisms were taken and were incorporated into a vaccine. And salmon farming now vaccinates fish. And as a result, they've not only seen a decrease in use of antibiotics, but they've also seen an increase in production. So this is a win on both sides, and this is what's very important for the agricultural community. Because in human medicine, the bottom line is saving lives. In animal health, it's saving lives, but it's also making a profit. And so we have to deal with those two things. And if we develop vaccines for animal populations that are too costly, they will not be used. So we have to remember that in this one world, one health, we need to really develop vaccines which are affordable and can be used in both animals and humans to prevent infection and the use of antibiotics. Now, the last Swiss cheese event that I'm going to talk about is really one that shows you how innovation can end up preventing these events from occurring. This is the Nipah virus infection in Malaysia, and I'm sure many of you have seen these slides before. What this is an outbreak, a newly identified virus, 1998, in Malaysia, which was associated with pig farmers. And pig farmers were becoming infected, and it was thought at first that it was Japanese encephalitis. Then it moved into slaughterhouses as well, because in Malaysia there is legal pig slaughter. And in Malaysia, it was a disease among pig farmers and workers in slaughterhouses. It actually spread in pigs into Singapore, and as I say, it was thought that it was at first Japanese encephalitis. It turned out later to be a Nipah virus, and Nipah virus is closely related to other viruses carried in fruit bats. And so a hypothesis of emergence was developed in Malaysia that it was coming from fruit bats to domesticated swine and then into either the farmers or those who were slaughtering the pigs. Now, Nipah virus has emerged in many other countries since then, between 1998 and 2008. And you can see here that it was emerging in Bangladesh and in West Bengal and India. Now, very high case fatality rate. It's a disease you don't want to get, or I don't want to get. It's a very serious illness. And as you can see, it was occurring in Bangladesh. But there was a question of why it was occurring in Bangladesh, because pigs are not generally slaughtered in Bangladesh. They're not involved in the food chain in Bangladesh. And so a very clever epidemiologist at the hospital in Bangladesh, working out of the cholera research laboratories there, noted that in the hospital patients that he was seeing, he couldn't link cases to domestic animal exposure, including pigs, but it was known, or it was thought by him, that the fruit bat carried Nipah virus, and he found one person who was sick who he thought could have been involved somehow in a food chain from the bat to the human. And that was a palm sap collector who became infected. Now, palm sap is collected at the top of a palm tree overnight. During the night, it begins to ferment a little bit, and in the morning it's a nice cool drink which is bottled and which is drunk by communities. This is the fruit bat. The hypothesis was that bat guano was infecting the palm sap, and that palm sap, ready to drink, was infecting humans in the communities. So a very innovative study was developed with Stanford University, and you can see here what that study was. This is a bat in the top of a palm tree, and the string is holding the palm wine collection container, a clay pot that's collecting the palm sap or palm wine. In West Africa, it's palm wine. In Asia, it's palm sap. So you can see the bat, and what they saw with a 24-hour camera was the following. So what happened was that they had shown that this is a feasible way of contamination. And for those who didn't see it, I'll show it again. The risk is plausible through the food chain. Now watch the bat when it turns upright, and you'll see it urinate right over the palm wine. So this is clearly an innovative way of testing a hypothesis, but not proving it. So the next step that this epidemiologist did was he looked at clusters which continued to occur, identified by hospital surveillance, and he investigated in depth 3 clusters, 14 cases, 8 of whom died. 8 of those persons drank fermented palm sap regularly. 6 provided care to an infected patient. So the epidemiology of Nipah virus is clear. Clean up your hospitals so you don't spread it nosocomially, and cover the palm wine containers so bats can't infect them. Now, it's very tempting not to cover those palm wine. That's what the ideal would be. And there were community agriculture meetings where community workers, agricultural workers in this instance, were helping communities understand that they had to cover those palm wine containers. Now, the policy, the logical policy, is to cover those containers. And many communities are doing this, but the government has decided that the best policy would be banning palm sap, which is the wrong decision, as you know, because that will just drive it underground and no way of regulating or seeing what's going on. So what I've talked to you about is Swiss cheese events. And I would just say, when you think of One Health and One World, think of risk assessment and prevention based on the Swiss cheese model. Thank you very much.